Aesthetic procedure increasingly popular at several years now. Hyaluronic injection is the best. The term non-surgical rhinoplasty makes reference to use of injectable temporary measures. Either it's a primary when patient had earlier not received anything, or a secondary when given a touch-up. Adequate knowledge of nose anatomy is essential, and to avoid a possible adverse effect, if anything happens, keep the emergency kit ready. Superficial to deep nose at different layers, namely, I already discussed this one. So vasculature of nose deserves special mention. Arterial supply comes from internal carotid and branches of external carotid. So if any wrong things happen, it will either lead to blindness or to the brain central artery thrombosis, and patient may die also. And on the other hand, the vascularization of lower portion of nose is provided by sphenopalatine and nasopalatine arteries that give rise to superlabial and angular arteries anatomy. So that is the anatomy showing how the nose, cord section, lateral cord section showing that how the layers of the nose are placed over the nose. That is the nasal bone, upper lateral cartilage, lower lateral cartilage, skin, then deep fat, superficial fat, fibrous fat. It is like that only it is placed. Additionally, different complications have been associated with use of dermal filler, such as allergic reactions, infections, hypersensitivity, technical placement errors, and vascular compromise. Rhinoplasty using filler is preferred because the fewer side effects, shorter downtime, external nose between the skin and bone cartilage 4 layers, as I already discussed. Filler are usually injected in order of radix, rhinium, deep and supratip area. First start with radix, then with rhinium, then with deep, then supratip area. That is keystone area. To minimize asymmetry, the surgeon should always mark midline on the nasal bridge and perform procedure without deviating from it. If most nasal arteries are found in the midline or subcutaneous arteries, filler should be injected deep to avoid vascular injury, compromise procedure, rupture and severe embolization the nasal bridge. First and foremost, always aspirate before injecting. Avoid big bolus injection. If very small bolus, anatomical knowledge and shape of arterial injection is very important. Better to avoid overcorrection and always keep higher voltage injection ready in case of adverse. And these are the few clinical pictures. So in conclusion, the results of current study suggested our nose culturing technique, liquid reshaping technique by using HF filler is an effective, predictable and relatively safe procedure with high degree of patient satisfaction. Thanks. Any question from the audience? What? Cost of the procedure. Because usually 2 ml hyaluronic acid has to be injected at least to correct the minor shape. Like this is not a replacement for surgical rhinoplasty. It is to give minor corrections. So for that reason 2 ml is required. 2 ml usually costs 34,000 and whatever charge you charge as a surgeon. That is the cost.
Thank you so much, sir, for such a brilliant session infused with so much knowledge. May I request the console to please play the rhinoplasty video.
One of my signature procedures is the Tinkerbell tip lift. It's quick, less expense, no downtime. The results are instantaneous and patients are so delighted with this major change.
I'm Courtney and I'm getting a Tinkerbell tip lift done today. I wanted to change my nose for quite some time. I have an event coming up, my mother-in-law's wedding. There will be a lot of family photos and I'm decided to not be worried about what angles everyone's shooting at me from. I've always been self-conscious about my profile and how it looks in pictures and meeting new people and thinking maybe they're judging me, even though they're probably not. My dream outcome would just be to have the tip lifted and a straight bridge. I've never had plastic surgery, but I'm excited to get it done today. I was always kind of worried that people would judge me for getting anything done, but as I've aged, I've kind of just said, screw it, do what makes you happy. It'll really help boost my confidence and show my daughter the confidence that I'd like her to have. I haven't done anything for me in quite some time since having kids. It'll help me just feel more comfortable around not thinking too much about everything, and I'm ready to just treat myself.
I'm Dr. Kay DeRayraj. I'm a board-certified head and neck surgeon and facial plastic surgeon in Los Angeles, California, and practice is Beauty by Dr. Kay. I've been in practice for 20 years, and my specialty is faces. I'm a facial artist. I do head and neck surgery, which includes the plastic surgery for noses, rhinoplasty, non-surgical interventions, lasers, and skincare. I see that there's a large dorsal hump, and I definitely see that downward tilt. So the liquid rhino is 2 steps. I do about 90% of the procedure today on the first visit, and we'll do a follow-up visit within 30 days. That's where we'll do finishing touches. Now the fun begins.
I'm excited. I'm a little nervous for how it might turn out. Everyone's nose is different, so I don't really know what mine's gonna look like.
Step 1 in my Tinkerbell tip lift is applying the numbing cream, and that's a topical anesthetic to really anesthetize and make the procedure more comfortable. Step 2 is a really careful assessment of the face, the nose, and the anatomy. Step 3 would be marking facial proportions. I use a caliper and define the nasal angles, like the nasofrontal and nasolabial angles. Step 4 is the actual injection itself. I use very precise technique with micro droplets of filler placed to create exact contour along the dorsum and bridge of the nose all the way down to the tip. In shaping the nasal tip, I'll use a technique which I've developed to create almost like a cartilage graft with filler placement. So visualize getting into my eyes in place of the filler. What I would do in the operating room with cartilage, and instead I'm using filler to build the contours that will give very sharp tip defining points and elevation. The last step might be placing neurotoxin or Botox to stop muscles that make traction downward on the nasal tip and give that extra perky elevation. Next, I'll apply some mild pressure, smoothing the contour of the filler, be sure that everything is aligned. This is my favorite moment when I get to show you more. Thank you. Are you excited? Wow. It looks so good. It's so pretty. Trying to cry. It looks so nice. Even from the front. I didn't expect to change the front, but it really changed the front too. All these years or so. Yeah, it's so pretty.
I'm excited to see what my husband thinks. I feel great. I feel like a new woman. I love it. She did such a great job. It was everything I wanted. Perfect. I'm really excited to go to the wedding and take my family photos and just be really confident about what she's going to do. It's kind of unbelievable how much she can do with just a little bit of time and filler because it's such a drastic change.
The Tinkerbell tip lift can last 12 months or longer. Some of our patients see results that can last 18 months. And if our patients come back with a follow-up serial visit or after 3 sessions, it feels almost 7 months.
Dr. K and I decided to straighten out the bridge and really lift the tip and hit the tingle effect. And we also placed some Botox in there to help lift everything up. The thing on a scale of 1 to 10 was probably the 1, if that.
This has been such a popular procedure now. This is one of my favorite things to do because it brings patients so much happiness and satisfaction. It's always so rewarding to see them really enjoy this brand new look.
Working with Dr. K was really great. She was sweet, she was really informative, let me know everything I need to know, and overall it was a really good experience.
It's literally almost like a magical procedure. The transformation is instant, the satisfaction rate is through the roof. Everybody is so delighted and it just brings tears to their eyes to see this really magical transformation. So that's why I call it the tip.
That's a really emotional thing in my life. I've been wanting this for so long that finally getting to see it and see it change so fast was just really. In about 30 days, Dr. K is going to come back and he's going to touch us and see if we can tweak anything here or there. And I'm really excited to.
Thank you. Sure. Thank you so much. That was a video brief on liquid rhinoplasty. Now, ladies and gentlemen, we'd like to move to our next session, which is for thread lift, and I'd like to request the very dynamic Dr. Ruchi Gupta, the senior plastic and cosmetic surgeon, please join us on stage. And request all to please welcome with a huge round of applause.
So today I am talking on something which is in vogue at present, and that is federation. The religion has already emphasized the importance of youthfulness and beauty. And as he said, thanks to the advancement in medical field, the life expectancy is definitely increasing. And with that, the desire to stay youthful and beautiful is also in demand. And that too, if it comes by a very minimally invasive procedure, that is a silver lining on the cloud. And hence, the process of thread lift came into the being. So, the one of the most disturbing things today is aging. And aging affects all the tissues. It is multifactorial. The major areas for the face, the tissues that causes aging in the face are fat loss, which causes the hollowness, the muscle activity, which causes the development of the folds. There decreased collagen and hyaluronic acid, and along with gravity, causes sagging of the skin. And all these together causes the face shape change, which of the face, shape change of the face, which was like an apple in the younger age, becomes like a series at a later age. So, to start with, we should always learn from our past. In 1916, Eric Lexer was the first person who performed the facelift. What he did was just superficial skin, he just stretched and it tucked into the pre-auricular region. The problem was that it gave a whiteness expression and the deeper tissues, because they were unaffected, the results were not very long lasting. Then in 1970, and that persisted for 60 years. Then in 1970, Paul Tessier gave the concept of SMAS, that is superficial muscular aponeurotic system. And that is the basis of today what is called the identity or the facelift. Today, a deeper incision and a longer incision is made, and by which the submuscular aponeurotic system is stretched towards the skin, decreasing the sagging, and it is excised, and the incision is closed. This procedure is very good as far as the results are concerned, but the problem is there is a high risk of surgery because of the big surgery, and there is a longer downtime. So came the concept of thread lift, which is a very minimally invasive surgery. Now, it is for the thread material to be good, there are two criteria. One, it should give a good lift. Another is it should give a collagen stimulation, so that brings up the plumpiness to the face and a younger looking face. So the thread materials have also evolved over a period of time as per the surgery. Today, the commonest threads which are being used are polydiaphragm or PDO, PLLA and PCO. These are all the absorbable sutures. Previously, non-absorbable sutures were being used, but the problem with them was that they were causing a lot of scarring and there were marks on the face. The advantage with polydiaphragm or PDO threads are the most commonly used threads today. The absorption takes place in about 6 to 8 months. It does stimulate the collagen, but it stimulates collagen 1, which is not that good for plumpness. The effect lasts for 1 year. A better version of the thread is PLLA or poly-L-lactic acid sutures. Compared to the PDO, these sutures are stronger. The advantage is instead of using 5 PDO sutures, we can go ahead with just one PLLA suture. The collagen formation in this type is type 1 and type 3 also, which is more important from the plumpness of the face. The absorption takes longer, that is approximately 12 months, and the effect of thread lift with this procedure lasts up to 2 to 3 years. And this is the best one today. This is polydiaphragm or PCL threads. These are absorbable threads again, and the absorption takes approximately 1 to 15 years. The important thing here is the effects here are longer lasting, up to 3 years, 5 years, depending upon the number of sutures we have taken, depending upon the muscular activity of the face that the patient does, and the type of the skin patient has. It is degraded into carbon dioxide and water, so it doesn't leave any residual problems. The collagen fiber formation in this again is type 1 and 3, but the advantage is type 3 collagen formation is much more as compared to type 1 as per the studies. And it is mostly used, and therefore it is mostly used in the specific area like most where we do not want to revisit the situation. What are the type of threads? It is not only the material of the thread that makes the difference, it is also the type of thread that makes the difference. Initially, the monofilms were used, which was not up. Then there came the screws, which gave more flexibility to the tightening, and then take the bar future. Basically, the concept of head lift is that you hand the skin onto the bar. So the number and the shape and the direction of the bar makes a lot of effect in the deadlift results. So there can be unidirectional bars, there can be bidirectional bars, and the third generation or the top bars are the 360-degree helical bars like rows on which the skin is stretched and hung. And these give a longer and a stronger support. Another type is the cone. These are mainly used for the jaw or the chin lift. And these are cone and are stronger versions of the thread. What are the advantages of thread lifts? Flattened learning curve. That means it is easier to learn, easy to perform, easy to replicate, and easy to get similar results once and again and again. It is less costly as compared to a typical surgery or whitening. It has a less downtime and it is an OPD procedure. The most important is this. It is an OPD procedure. Patient comes in the morning, by evening they can consent at home, and he can take rest at home and join his work. From today, the world of work from home, they can perform their official duties also. It gives us a very immediate effect. So who are the candidates where you should perform these surgeries? The perfect candidate is the lady between 35 to 40 years of age. However, any age is not a contraindication till the patient is good for surgery. So age is 35 to 45. There should be the patient in this age, minimal signs of aging are coming up. That means there is a deepening of nasolabial fold, drooping of the mouth, developing crow's feet and frown lines. So just when the aging process begins to be revealing, we should start working there and there itself. What all can be done? We can do a brow lift. Brow lift can again be done in two ways. One, by the spring threads which are non-absorbable. They are inserted from the temporal and almost like brow is hung or on the thread, and it is hooked around the brow. And it is usually used in the male patients where larger lifts are needed and older patients who are not very fit for the surgery. The other option is the video threads, which are temporary threads, small lifts where we need a small lift and short lasting. It also acts for the new collagen formation, and younger patients are the prime patients for this. Other option is the frown lines. We can also work on the frown lines. Now, why the frown lines occur? They occur because of the effect of corrugated superciliary muscles. And because to negate the effect of the muscles, here we need a more number of threads. So a mesh of thread is created, and that takes away the folds of the skin, and you get a youthful skin. This is the most commonly performed of the nasolabial folds, and this is the most rewarding also. But according to the patient, we have to decide whether we need to hook the threads on the preauricular region, temporal region, or at the lateral orbit margins. But the effect, this is the most rewarding procedure. Apart from this, we can also do the minor procedures of contouring of face, that is taking care of the crow's feet or the lip contouring and the smoker lines by threading. Jawline care is another procedure which is commonly done, and it has a major effect on the face, aging face. So how does the thread lift works? As we see, the patient begins to get the and when we put the thread, it causes a mild inflammation and scarring. We cannot call it scarring. It is a very helpful scarring, like in the sense that it causes fibrosis. And when it causes fibrosis, it causes the tightening of the skin. Along with that, the collagen formation gives the plumpiness to the skin and A needle along with the thread is inserted. The needle is taken out, leaving back the thread in the subdermal region. And then onto the bars of the thread, the skin is hung to maintain the tightened position. Post-op care, not much to do. Go home very evening. May expect some swelling in bruise that may persist for 2 or 3 days. So it should be ideally done in a time when the patient is not going for any social function in those days. Wash the face after 24 hours. No massaging. Ice pack application definitely helps in decreasing the swelling. And some amount of antibiotics and swelling decreasing agents like thymopressine do help. With all these procedures, this is what the result we expect. In conclusion, I will say, aging is a continuous process. Hence, its repair should be continuous. No single anti-aging procedure fits to all patients. So one has to choose the appropriate procedure and get desired results. It can be used in combination with lasers, fillers, or HIFU or Botox. A thread lift is a simple and effective procedure without any long-term side effect. So, thank you. I'll be happy to answer the questions. If there is any.
Since forehead is thin skin, so the thread is visible after you put the thread in the forehead area. What is your experience?
Sir, we put it under the just above the abdominal muscles. We can hide it after the delivery. It's not a problem.
And what type of the thread is
PBU
used?
threads are commonly over here. PBU threads are used.
And any chance of injuring the supraorbital and heart? No. Frontal or supraorbital? Oh, thank you.
We'd like to thank Dr. Chiku. Can I have a huge round of applause now? The session is absolutely very neat and she also answers the questions so gracefully. Thank you so much. And now, ladies and gentlemen, it's time for the product launch and the course launching of certificate course that we all have been waiting for. We have with us the very revered, the very respectable, and the Mr. Funny Bones of Hollywood industry, who has been a stalwart in what he does. Can we please have our Samastantara, Bahut Priya and very, very favorite Hari Bhai, who deserves the Shalal song, and please have a shout on the stage. I request to deserve the Shalal song. Please welcome him on the stage. So please. And thank you so much. We have a very dashing, very versatile, and very talented Hollywood actor, none other than Mr. Deepak Kumar Raj. Please welcome him on the stage as well. And we have a wonderfully versatile and very gorgeous Ms. Arpita Sahu. She's also been one of the frontline TV actresses. I'll request her to please join us on the stage as well. May I also request Dr. Chidanaka, please join us on the stage. We are going to launch the product Vita Glow, which is the most talked about. But it's a very request always Zola Talimuchi for such grace on the stage who have managed time and have joined us today. I'd also like to request Dr. Tonaleshwar Mahapatra to please join us on the stage. I'd also like to request Dr. Pallishri Darai to please join us on the stage. We're going to launch today on this COSMETICO 2024 stage is Winter Glow. The Winter Glow Night Cream removes the layer of dust and makes your skin look fresh and healthy. Winter Glow Night Cream is beneficial for men and women both. So the night cream not only is a cream in the world which in a very short span of time makes you look beautiful, while other only provide aspiration. And I'd like to unveil the product Winter Glow for all to present you, ladies and gentlemen. And you can see the effects of Winter Glow in just 7 days. In just 7 days, you can see the visible effects of this wonderful cream, which gives you fair skin within 7 days, and with SPF it cures wrinkles, dark circles, and spots without any side effects. We have something special, and once again, stars who are here with us on the stage for finding time from a busy schedule and joining us for the product launch of Winter Glow. May I kindly request Dr. Shilapa to please present a small token of love and appreciation from COSMETICO 2024. Ladies and gentlemen, can we have a huge round of applause for our very own and very dear Vanpai. And now, thank you, Deepak, for finding time for us and joining us here. And we'd also like to thank Arpita for joining us today on the stage to launch Winter Glow for all of us. So we've also done a course, launching of a certificate course on clinical cosmetology. You can get all the details from Dr. Mona Lisa. And just for your information, ladies and gentlemen, please pay attention. The course is available to you today for 50% off the offer values, all only for today. So I request all of you to please make sure that you make the best of the offers that is valid only for today. The course is available for 50% off just for today. I request all of you to please get in touch with Dr. Mona Lisa Mahapatra. Apologies. I request all of you to please get in touch with Dr. Mona Lisa Mahapatra and get to know all the details about the certificate course. Course launch. And now, ladies and gentlemen, we move ahead for the video presentation by Magneto Pharma. May I request Dr. Akshay Rao to please join us for the course certificate launch, and then also request Anbhai, Deepak and Arpita to join us for the course certificate launch once again. So we're going to unveil and launch it for all of you. A huge round of applause, ladies and gentlemen. With this, we launch the giving
If you wanna take a ride with me.
Ladies and gentlemen, nothing more than was for the last. And that is how we're going to go to 2024 and the course launches for the certificate course of clinical cosmetology is hence launched. Thank you so much. I request all of you to, may I request our guests and may I request Dr. Rao to please take your seats. Next up, we have a video presentation by Magneto Pharma. I'd like to request the officials from Magneto Pharma to kindly join us on stage. We'll move on for the GFC for hair development and for acne and scars. I'll request the team to kindly join us on the stage. Ladies and gentlemen, for your information, the next session is for GFC for hair development and for acne and scars. I'll request the team to please join us on the stage. Ladies and gentlemen, we would now like to have our next session for Haiku by Dr. Lakshmikant Mishra. a senior plastic and cosmetic surgeon would like to request Dr. Lakshmi Mishra to kindly join us on stage.
These technologies used previously later 1970 lasers, 1990 intense spotlight, 2004 radio frequency, then 2005 retinal. Since last 2015, I do. You can see it is affecting almost all the layers of the skin, up to the level of the muscle, above the level of the muscle. Hypo mechanism it generates high intensity focused ultrasound, induces vibrations in the molecules on the targeted area, leads to thermal energy which is caused by the pressure or thermal coordinated zone. You can see hypo, this rays, radio rays, affecting heat coordination focus, affecting immediate tissue, record, solar information. Hypo is mostly affecting up to the level of mass in the base layer. And after the level of the upper layer in the particulars level, they are the superficial external layers, laser and the alpha, used for the superficial layers of the skin. Hypohybrid system for face and body. It is helpful with the 3 types of hair, 1.5, 3 mm, 4.5. Yeah, the frequencies are 4 and 7 megahertz. These are the cartridges used for this hypo. You can see this 1.5 millimeter depth for this superficial, for the skin, forehead. For 3 is the deep dermis. For this mass layer 4.5. For the abdominal, usually we use abdominal level 30 millimeter. For the chest also, this is we use also 30 millimeter. One last one. These are the indications of the hypo. This is speed tightening, rejuvenation, non-invasive lifting of the face, eyebrow lifting, jaw lifting, nasolabial fold reductions, double chin reductions, body contouring. This is for this body also different type of cartridges used for this upper arm, D4, upper chest D4, D7, lower hands D4, D4, hip L4, D5, abdomen L4, D4, thighs L4, D4, legs also L4, D4. These for the face, these are the cartridges used. You can see this cheek, the mid face and the lower face. Usually you use this millimeter or 3 millimeter cartridges used. For this D4 and D7 also helpful for the cheek area. For submental area, we never use this area, this thyroid area should be avoided because the thyroid gland will be damaged when you apply over the thyroid area. By this hypo method. So the side effects of this hypos are paresthesia, swelling, pain and logistic. Paresthesia is usually due to thermal injury to the trigeminal nerve can lead to transient numbness. It can cause also temporary facial paralysis. So it usually recovers within around 1 to 2 months. This temporary paresthesia is usually gone. And sometimes we also give some Lyrica tablet or pregabalin tablet to prevent transient numbness of the face. Swelling, usually redness and swelling appears due to this hypotherapy, and during further results we apply betamethasone and also some steroid products to prevent the swelling of the face. Pain subsides with time. Within 1 week the pain usually subsides. Nowadays, pain is a really very common complication of this hypo. Now, the technology has changed and the painless hypo medicines are coming and it is helpful for the facilities. After that, to avoid direct exposure to sunlight for 48 hours, to apply SPF 50 ointment lotion after this therapy, to avoid excessive exercise, hot bath for 1 week. The advantage of this hypo is no surgical instrument required. It is better than, I can compare better than this water therapy. Water is an injectable therapy, whereas it is a non-invasive and we apply just this area exactly effect on the target disease operative procedure with a short recovery time. Patient can return to work on the same day. Few questions usually asked by the patients for the hypotherapy. Hypo means facial paralysis? No. Facial paralysis is usually not noticed in the hypo, but those who are unexperienced and unexperienced people, they they do this procedure, and sometimes this may cause also facial weakness, but it subsides within 1 week. Dog hypo is loss facial volume of the cheeks usually not there. Experienced hands it should be done. Hypo should be done in experienced hands. Can hypo make age spots melasma worse? No, not at all. It is not affecting into the melanin cells. If I stop having regular hypo, will my face against muscles? Yes. Usually this is not there. But if you stop this, usually this hypo will continue for 9 to 10 months for therapy, and again 9 to 1 month, 10 months, you have to repeat the course. When you repeat the course, this facial cell will be continued for there. If you discontinue, then this cell will be, this against will appear again. However, if I fail during the treatment, it's usually when you apply this hypotherapy, within 4 to 5 days, the tightness will appear. By 7 to 10 days, this facial appearance will be changes very nicely. In hypo is painful. Initially, when it was started, the hypo was painful. Now the technology is changed, and painless medicines are available, and no pain will be noticed. And usually we apply also the combination is Pralogan gel. It's a local anesthetic gel to apply on the face, and over that the hypotherapy will be continued. Which is better? Hypo or dermal injections can be combined with both. Usually, hypo is different mechanism. Here it is helpful for the skin wrinkles correction, whereas filler, dermal filler is helpful to correct the volume of this face. We can combine both these procedures in hypo and dermal filler in a single face. Hypo does not work if you are too old. Because it's true. Usually in the old age, more than 60 to 70 years, you will see the shaking of the face are noticed. In that condition, facet is a surgical procedure. Here, 40% of these collagen tissues are damaged, and in that condition, hypo is not helpful. Here, you have to go for surgical correction by facet procedure. Can I have hypo while having a tired lip, thread lip? You can combine both the procedures. Dr. Ruchik already told. Thread lip can be combined with hypo and also bottom therapy. Can botox and dermal filler can be affected by the hypo? It should be contracted. The hypo should be start after 1 month of this botox and dermal filler therapy. I am micro-needling on my hypo. Can I still have hypo? Yes. It will be started 1 week after this micro-needling of this hypo. This is the view. These are the different type of techniques that you can see. M4 for 4.5 for this neck region. N3 for this, you can 3 means 3 millimeter depth. Here that can be used for this region. This mid face should be used by the N3. Mostly we use 3 millimeter technique. Here, this carotid area, these are the different settings are there. Energy and the fluence, this frequency should be done like this. This chin area, double chin area also means the submental area. You can do also this type of. Usually, 4.5 countries in that condition. 4.5 should be used for neck area. The midline of the neck should be avoided as the thyroid gland is there. Thyroid gland may be affected by this high intensity focused ultrasound. That damages the thyroid gland, and sometimes this causes also goiter. It should be done in a proper, experienced hand properly. In that direction should be both the direction, horizontal and also vertical direction. These are the different type of heads, and also this frequency, the fluence, this energy should be adequate And if you apply high energy to this region, there is chance of burn and also there is chance of swelling, facial edema, and it should be treated as early as possible. This is forehead area. You can see this cataract size is 1.5. Here the cataract size 1.5 millimeter should be the this depth of this area. Otherwise, there is chance of damage to the supraorbital and supracochlear nerve. Along with this one, this HIFU, we usually use this radio frequency. This is the round one set. You use for this neck area. This also stimulation. Forehead area also you can use. Different type of this is also radio frequency used for this for collagen synthesis and collagen stimulation for this reason, and it causes to prevent the sagginess of the face, which can be noticed only after this therapy. This is a video. Double gold it should be comfortable. Patient develop some pain. We have to change the place, and if we can apply some numbness, this local skin applications therapy. This 7 Pro creates the superficial layer of the skin, improve the texture, tone, fine lines, and pores. I go use the ultrasound waves precisely target tissues in the treatment area for the collagen tightening and collagen removal. Without any downtime, this is immediately put the result develops over 3 to 4 months. These are the benefits of the hypofacial. You can see double chin area, eye lips against skin, the neck area, the jowl area. This all area can be corrected by hypofacial except this midline of the neck. See the clinical results from jaw lines corrected by this hypotherapy. Eyebrow lift is possible by this hypo. Jowls and cheeks can be corrected by this hypotherapy. Thank you for all. Any questions you can ask also.
Hypo is a good procedure to do the collagen remodeling. What is the proof you first use, then what are the frequency you use?
I have used 3 cartridges, 1.5, 3 mm and 4.5 mm. And 4.5 mm should be used for the neck region. And the midline of the neck should be avoided as thyroid gland is there. Over that, if you will use this cartridge 4.5, there is chance of to damage to this thyroid region. So better to do 2 fingers lateral to this midline on this area. And over that, the lateral part of the neck can be corrected. Whereas the mid part of the neck can be corrected by the bottom therapy, right, or laser therapy, or you can go for a fat transfer, fat grafting therapy. But in the mid area, hypo should be avoided. Literature says that there is chance of changes to damage to the thyroid gland. And second thing, I feel I would compare to the Botox, it is definitely better as it is a non-invasive procedure. Whereas Botox is an injectable procedure and should be given in an experienced hand. There is chance of literature shown from saying that even if some patients also intubated for 3 to 4 months due to trachealis muscles was injected accidentally by this Botox therapy. Whereas in the eyelid also, when Botox is also given, sometimes a lag of firmness and dosage also appears in the case of Botox. But the literature is very, very minimal, less complications shown in the hypotherapy.
Usually, what I am practicing that 1.5 start with
Forehead area should be
and avoid that preauricular area and mental area so that the nerves will not be
used.
here.
Actually, for forehead area 1.5 millimeter thickness. For the mid area 3 mm. For the neck area 4.5 mm. These are the 3 areas should be considered. Accordingly, we should go for the hypotherapy.
Can it be used along with thread lift?
It should be used, but I think better to do after 1 month of this therapy. Whatever the literature says, the Botox therapy, the fillers, and also thread lift, when you have someone has done, it should be done after 1 month of this therapy. Not to combine in the same thing.
Okay, thank you.
Thank you.
Thank you very much, sir. That was very brief. I request all of you to please maintain some silence. This was a request from the officials. I request all of you to please maintain some silence behind so that the sessions can be clearly audible to each one presenter. Moving forward, I'd like to request Dr. Jayant Kumar Das, Senior Plastic and Cosmetic Surgeon, to please join us on the stage for his next session on Botox.
Very good afternoon. So at the outset, I would like to thank Dr. Akshay Raut and Madam Chidatmika Madam for this nice, innovative thing. And this is a very good concept. We all are in a same forum: plastic surgeon, dermatologist, dentist, Ayurvedic doctor, homeopathy doctor, cosmetologist. So we are all in a single forum, and we should break that barrier. We should all work together with the idea, with the concept, with the science. So that is the motto of this conference. And so we should have an idea about all the scientific things. What is the limitation? What is the contraindication? What are the adverse effects? So we should have a clear idea before dealing with the patient. Because as per the Hippocratic Oath, we should do no harm. So that is the first thing we should do whenever any patient, or we call it client, who comes to us. We should not do any harm. So that should be the principle, that should be the philosophy. So why I have written toxin? It's not Botox, why it is toxin? So toxin, Botox actually is a trademark. So it is a neurotoxin, that's why I have written it toxin. And the topic, my topic, is entirely on this toxin, and especially the Botox is very popular, so that's why we call it Botox. Just like any detergent powder, we call it surf, because that is the oldest one. So it's the Botox which is the oldest one and very popular, that's why we call it. Any toxin we name it, from any brand, we call it Botox. So, at the outset, no financial gain or any financial interest from the company. And the term Botox is almost synonymous with the neurotoxin because it is very popular and very old brand. So, let's talk about Botox. So, Botox, it is the botulinum toxin. It is derived from a bacteria, gram-positive bacteria, Clostridium botulinum. And it is the #1 non-invasive surgical procedure in any cosmetic clinic. Botox is very popular as a non-invasive procedure. Dr. Alan Scott is not a plastic surgeon, he is not a cosmetologist, he is the ophthalmologist or eye specialist who first introduced this molecule in the treatment of strabismus, that is eye spasm. After that, it is approved by FDA in 2002 for the frown lines or forehead lines and crow's feet. Later on, there are many usages of Botox in different things, in cosmetology as well as some plastic surgical things also. There are 8 types of botulinum toxin, and the type A and the type B, they are very popular, and type A, especially the Botox, is the most popular thing. And the effect of the Botox, many people they are very confused when the effect of the Botox will start, when it will have the peak effect, and how long it will last. So theoretically, the effect will last within 24 to 72 hours, that is 1 to 3 days. And the peak period is 7 to 14 days or 10 days, or sometimes 21 days it will have its peak effect. And it will last for 4 to 6 months only. So many people think that it will last for 1 year, it is permanent. So it will last only for 4 to 6 months. After that, again you have to undergo another session for effect. Another is the storage of the Botox. You should have a clear idea how to store the product. Unless until you store the product properly, it will be not effective because there will be a break in the cold chain. So when the Botox is not reconstituted, it should be stored in freezer, that is the ice chamber. It should be less than -5 degrees centigrade. Once it reconstituted, it can be stored in the shelf of the fridge, that is at 4 degrees centigrade temperature. So storage of the Botox is very important. So before reconstitution, it should be stored in ice chamber. After storage, it can be stored in normal shelf of the fridge. So, and if you compare the male and female, some male they need higher dosage of Botox because of the stronger muscles. And it is always reconstituted with 0.9% freshly prepared normal saline without any preservative, so that there will be no side effect related to preservative or no allergy related to preservative. So this is the Botox. As I said, there are 8 types of toxin. The toxin A and toxin B, they are very popular, and toxin A is the most popular, and the Botox, which is the botulinum toxin, it is the most popular form of neurotoxin which is used in cosmetology. What are the clinical applications of the Botox? So Botox is being used to erase facial wrinkles. That is the most common application for Botox. Apart from wrinkles, it can be used in hyperhidrosis or excessive sweating underarm, sometimes excessive sweating on the palm, sole, it can be treated. And now it's a new thing, Botox is being used for hypertrophic scarring. To make the scar less visible, Botox is used. That is the new use of Botox. And sometimes the micro Botox in a very diluted form can be used, which is known as baby Botox, for rejuvenation of the face. So how will you select the patient? So patient selection is very important. You should select the patient instead of procedure. So your selection should be very clear. Your criteria should be very clear. You should notice any asymmetry on the face, because after the procedure it will be exaggerated, so there will be result will be bad. So any facial asymmetry should be pointed out before the procedure. Sometimes those who are in a profession expression like acting, you should judiciously use the dose of the Botox. If you use it excessive dose, then the facial expression will be limited. So you have to be very careful if you are using Botox, especially those who are in film industry. And photographic documentation nowadays is very essential to prevent medical legal hassle and to point out or to see the result. You can see what is the difference in before and after photo. So that is why the photography is very important, and you should take the consent of the patient. Always take a written consent of the patient, so that if any adverse reaction or complications will happen, so that you can say that you are admitted to get treatment from us, and you should be very clear in that these are the things I have explained before the procedure. So counseling is very important. You have to counsel the patient. If people have very unrealistic expectation, they will think that by applying Botox, all the lines will be erased, there will be no wrinkles, which is not true. So Botox will give a near natural or soft look, but it's not meant that all the wrinkles will be erased. And moreover, only the dynamic lines will be effective, because the static lines can be corrected with filler, but Botox is mainly used to treat dynamic lines, that is the lines which are visible with facial expression. Skin sagging will not be corrected by Botox. There are other modality which will rectify, like HIFU or other things, thread lift, but skin sagging will not be corrected by Botox. And if you are planning for Botox, always prefer to do it before your any important event, like 1 week before the event, because it will take time to settle. So, and the bruise and the swelling will be minimized. So it should be done at least 1 week before the event. And you should very clearly mention about the dosage of the Botox and the cost. Your dosage should not be limited by the cost factor. If you require 140 units of Botox, then cost will be higher. So patient should not bargain that I will give this much money and you do it 64 units or 80 units. So there is no bargaining while as far as the treatment is concerned. And patient has to avoid anti-inflammatory NSAIDs, drugs, painkiller, green tea, vitamin E, or other blood thinners, so that there will be no bruising or swelling after the Botox injection. So this is very important. Then procedure, topical anesthesia, if required, should be used. Those who are very sensitive to pain. So before the injection, apply topical anesthesia cream like Relax for at least 15 minutes. After that, you can do the Botox can be started. Or nowadays there is a cold vibrator. So at the site of injection, you can apply that vibrator. So it's like a dissociative anesthesia. Patient will not feel the prick sensation. Patient will feel the vibration sensation. And cleansing is very important. All of the cosmetic patients, they come with heavy makeup. You have to clean it properly. Before injecting Botox, clean the face properly with a good cleanser, then start injecting Botox. Marking of the points where you are going to inject Botox, that is also very important. So that after cleansing, you should mark the area where I am going to treat, and you should observe the activity of the muscle also. The area where the muscle is more active, you have to inject the Botox in that area, so that there will be good result. And always it is done in a sitting position, not in supine position or sleeping position. It is sitting position, so that the result will be visible immediately. It's a partial result. After 7 days or 10 days or 21 days, the result will be final. But it should be injected at the sitting position of the patient. And lighting should be good, so that you can very well see the thing where you are injecting. What is the post-procedure care? What are the things you are going to advise to the patient? Is the Botox, what are the post-procedure or post-Botox plan? So it's a zero downtime. Almost after the Botox injection, patient can attend any party or disco, anything, any function, but there will be no visible, so it's a zero time. There will be no immediate any complications or any side effect. And the manual pressure should be avoided. After injecting, don't massage the area of injection site. And immediately after the needle withdrawal, you should press it for some time. But once the bleeding is stopped, don't massage the area. You can apply ice to decrease the swelling or bruise. You can apply cold pack or ice. You should avoid sitting band, bending, cooking. So these are the things to be avoided for at least 6 hours. You should sit. You should not sleep immediately after the Botox treatment. No bending, no constant cap, no helmet, and or cooking in a hot stove. Also avoid exercise. Heavy exercise, alcohol within up to 24 hours of post-injection. Yes, even airline travel is also not encouraged. Then massaging of the area is highly discouraged, so you should not massage the area of the Botox injection site. So Botox injection will spread into the adjacent muscles and there will be other side effects or complications. What are the reasons of failure? Why Botox does not work? First thing, your technique should be strong. You should give it with a proper technique at the proper point with the proper dosage. So that is very important. The technique should be correct. Dosage, as I said, it should be adequate. No cost cutting with the dosage. Whatever the charge you have to take, you take, but give adequate doses so that the result will be good. If you are not maintaining the cold chain in your clinic, so Botox toxin is denatured, it will not be effective. So you have got it, but after injection, it will not show its result because you have not maintained the cold chain. So that is very important. And if your selection is wrong, if you are trying to address the static wrinkles with Botox, then it will not be effective. Always target the dynamic wrinkles, which is visible on facial expression. What are the complications of Botox? Pain, very mild pain. Sometimes it can be subside of its own, or you have to take some analgesic like arnica cream or homeopathic arnica medicine you can take. Bruising and swelling, it will be subsided with the ice pack or cold application. Sometimes the patient will complain of transient headache. And if you have massaged it, or sometimes because of the wrong selection of the injection site, Botox will migrate into the adjacent muscles and there will be complications. Few people, very rare, they are allergic to Botox, not exactly the Botox. They are allergic to the preservative or alcohol which is used. So you should keep in mind regarding the allergic reaction of the Botox. So what are the contraindications? In which patient you will not inject Botox? Number one, pregnancy or lactating or breastfeeding mother. Allergy to the Botox injection, previous history of allergy. Psychological instability. Patient have unrealistic expectation. Patient is not happy with any procedure, body dysmorphic disorder. So you should avoid those patients. Then neurological problem like myasthenia gravis, other neurological problem, don't inject Botox. And if patient is a lot thinner, at least blood thinner should be stopped 5 days before the procedure. So you should keep in mind whether the patient is on any blood thinner like Asthetic, or clopidogrel. What are the common myths related to Botox? Number one, many people think that Botox is immediate. You will have an immediate result, which is not true. It will take 7 to 21 days to have its result. Botox is permanent, which is not true. It will last for 4 to 6 months. Again, after 6 months, you have to repeat the session. Botox is only for women, not true. Many men are interested nowadays because of the self-image or because of the social media, they are ready to rejuvenate their face. So many men are also coming for Botox injection. Botox makes you look frozen or expressionless, which is not true. If you are injecting Botox in a right dose, then it will not have any effect like frozen appearance or expressionless face. But if you are injecting a higher dose or your dosage is excessive, then it will happen. So Botox is very safe in those who are in film industry or acting career. So it will not, if you are using it in a right dosage, then it is very effective. It will not produce frozen appearance or expression. Botox is unsafe. Nobody knows its long-term effects. So for your information, Botox was FDA approved in 2002. So it has been almost more than 22 years. So you know a lot about Botox. There is no side effect. Long-term, there is no complications related to Botox if you use it in a proper technique. So Botox is very safe. Botox can erase all wrinkles. Not true. Botox is effective only for dynamic wrinkles. When with the facial expression, when I am laughing or crying, there is wrinkles, or frowning, there is wrinkles. So Botox will act on those lines, not on static lines. Botox injection is painful. It's not true. If it is injected in a very small caliber needle, insulin series, which is very fine needle, so it's not very painful. If the patient is sensitive, he can keep local anesthesia cream before the procedure or use your vibrator, so it will be painless. So if you stop doing Botox, wrinkles will get worse. Again, many people that think that you will be addicted to Botox. You will take on Botox for lifelong, which is not true. Any time you can stop it, as per requirement, any time you can start it. So if there will be no long-term side effects, so you will not be addicted to the Botox. Similarly, once you start Botox, you cannot stop. You can stop any time. If you don't require Botox at that time, don't take it. If you require, take it. And you can take for a number of times in your life. Botox will affect my body. It is very localized. Whatever the effect is very localized, it is limited to the muscle where Botox is injected, so it will not affect your body. Anything, there will be no side effect or no adverse effect on any part of the body. Botox is only used to treat wrinkles, which is not true. Botox is used to treat excessive sweating, underarm, palm or sole. Botox is used to make the scar less visible, that is hypertrophic scar. And there are many other indications of Botox. Botox and fillers are same. Both are different things. Botox is botulinum toxin, filler is hyaluronic acid. Botox is used to inject the muscle, make it temporarily paralyzed for 6 months. Filler is used to inject the subcutaneous tissue or underneath the skin to fill it. So Botox is effective for dynamic wrinkles and filler is used to treat static wrinkles. So there is a huge difference between Botox and so to summarize, you should have a clear idea about the anatomy of the face, where to inject. Look for asymmetry or any other deformities before injecting. You have to point out to the patient that these are the things. Photos of the before photo and after photo and the consent. You have to reconstitute the Botox correctly. Right dose into the right muscles. Very important. And avoid massaging of the injected area. So there will be less side effect. Thank you for your kind attention. So any question?
Actually, what is the age limit to give the Botox injections? Like lower age group?
Lower age group, I think above 18 years. Because there is an article on teenage many procedures we should avoid except like gynecomastia, other things where it is necessary. I think before 18 years it's not necessary. And there is a concept called baby Botox also. Many young generations they try to rejuvenate their face. So Botox is used in a very diluted form that can be used. Micro Botox or baby Botox. It is only for rejuvenation.
Not only for facial rejuvenation, it is also used for other purposes.
Right, hyperhidrosis also. Hyperhidrosis.
There was a news that less than 15 years got injection of Botox and got complications. So this was in our cosmetic surgery group, so cosmetic surgery or PGI group. It is a matter of discussion that severe complications develop, so that whether it should be given to a patient having age less than 15 or it should not.
Right. It's still a matter of debate. But I think if the patient, the indication is really necessary, patient is embarrassed because of the hyperhidrosis or patient is not living the day-to-day life, then I think it can be used before allergy testing can be done or hypersensitive testing before the injection. It can be done.
And another thing is, what is the direction of taking and which plane you are injecting the Botox?
Botox is effective only on muscle. So there are different areas of the face. In the forehead, it will be very superficial because there is less subcutaneous tissue or fat. But if you are injecting into the corrugator superciliary process, you should inject half of the needle or more than that. You should inject into the bulk of the muscle. So depending upon the muscle where you are injecting, your depth of the needle will matter.
Okay, and if you accidentally enter into the vessel, any complication or not?
Definitely, the Botox if you inject into the bloodstream, definitely there will be some reaction. But always, you can, if you are injecting in a deep area, always try to aspirate before injecting.
And any chance of atypical microbacterial infections?
I think that's not don't idea. I don't have that idea. I have not faced, but I don't know about the future. Atypical microbacteria.
I had an experience that late Japjit Singh.
Right.
He had Botox on the forehead and got atypical microbacterial infection in the skin. And he got operated there in the USA. And I come across there, the Minister Japjit Singh there. So I found that sometimes his face was atypical microbacterial infection.
Microbacteria.
Okay, thank you.
I'd like to thank Dr. Chan for such a wonderful presentation and for answering the questions so deeply and elaborately. I now like to request and invite Dr. Chidatmata Agrawal to please join us on stage. This is regarding a felicitation to Mr. Sheikh Samin the chairman mascot, who is also on the assessment body on behalf of Skill India. I'd like to request him to please join us on the stage for recognition for the certificate course on clinical cosmetology. Thank you so much for all your kind support. May I request all of you to please put your hands together for Mr. Sheikh Sami. Thank you so much. We want you to know that we definitely value your integral support, so thank you so much once again. And with this, we'd like to request the team from Magmento Pharma to please join us on the stage with a huge round of applause. And just for your knowledge, I'd like to repeat that the certificate course is available on 50% discount today. Please make sure that you register yourselves, and Vita Glow is also on 500 rupees off just for today. Apart from that, I'd like to request all of you to please welcome Magmento Pharma team on the stage right now. And in case you haven't collected your lunch coupons, please collect it from the registration counter. Presenting Magmento Pharma and dynamic team on the stage right now.
Good afternoon, everyone. I am Anjali Agarwala, founder and director of Magmento Pharmaceuticals Private Limited. We are pleased to be associated with the world of aesthetics COSMETICO 2024. When I got to know about a part of the theme of COSMETICO, that is invest in women and accelerate progress, I really appreciated the theme because as a lady, I believe progress comes with Shakti. And as per our Hindu mythology, the word Shakti is associated with Nari Shakti. So let us together join hands, empower women and help them flourish and contribute for the betterment of the society. We at Magmento Pharma express our sincere gratitude for providing us with this opportunity for participating in COSMETICO 2024. Thank you for having us. So now let me introduce my company and just give a brief overview about it. Magmento Pharmaceuticals wishes to be the pioneering healthcare excellence from the heart of Orissa. And we seek your support to join us in our journey and make Orissa proud. So let me tell you something about our company. We started our journey in the year 2022 as a pharma marketing company to revolutionize the healthcare segment with quality medicines at affordable prices. We are currently operational in the Eastern India and are very soon ready to spread our wings to other geographies of India. Our vision, Magmento Pharmaceutical has a vision of putting Orissa as a hub for healthcare innovation in the map of India. Currently, our specialties are dermatology, cosmetology, nutraceuticals, and lifestyle diseases like cardiodiabetes. Very soon, we are going to launch with other therapeutic segments. So that's our team. We at Magmento believe in providing a very holistic work culture. Together, everything is possible, and together, when we walk hand in hand, we can achieve anything. So that's all about my company. Now, Since I am here, I have been given an opportunity to participate in COSMETICO. So let me tell you our view on cosmeceuticals. So we at Megmento believe the scope of cosmeceuticals is beyond surface beauty. The influence and the contribution of cosmetologists, aestheticians, doctors, not just limited to grooming and beautifying people. It is going beyond that. It helps in boosting our self-confidence. It is helping socially and economically to the country. With that, I would like to share a very small example on my take on cosmeceuticals. So I would just like to say, every one of us must have had a coffee somewhere in our lifetime. Coffee हमने तो पी होगी कभी ना कभी somewhere. किसी को पसंद है, किसी को ना पसंद है, but everybody must have had a coffee. So we can make coffee at home. We can even go and buy coffee from a coffee shop. So just like suppose I want to have a cappuccino. So I want to go to a cafe and I order a cappuccino. The cappuccino basically comes with a layer of froth above the coffee. So here the froth is adding life to the cappuccino. Without the layer of froth, the cappuccino does not make any sense, no doubt how good it tastes. In the same way, this is my personal view. You all are adding life and spark to the lives of your customers, consumers, and people around. So now, quickly, let me just take you to our products of interest. So right now in the derma segment, we have two baskets. We have classified the products. One is Cosmica and the other one is Derma. In the Cosmica basket, we are offering products under two brand names, two mother brands. One is the Bella series and the other one is the Glutacraft series. Under the Bella series, we have the Bella foaming facials. It is a glycolic and salicylic based foaming facials. Next is the Bella face cream. I must tell you, this is one of my favorites. It is a kojic acid based face cream which comes in a beautiful airless bottle. The third is the Bella face serum. It is a hyaluronic acid, alpha arbutin and niacinamide based face serum. The next is a nature-based Bella moisturizing lotion, which is a gel-based lotion and is quickly absorbed by the skin. The next is the Bella sunscreen gel. It is SPF 50 gel-based sunscreen gel, which is again quickly absorbed by the skin. And under the mother brand Glutacraft, we have glutathione, NSC and vitamin C effervescent tablets, and very soon we are going to launch Glutacraft based and other SKUs to our basket. This is the products of our Dermica division. So that's all about our company. Lastly, I would like everyone to give a big round of applause to you all for contributing so immensely to the society. And ultimately, I would like to say that Megmento is a company which is from Odisha, which is by Odisha, and which is for Odisha. And as a child born in Odisha, I am here seeking your support and your blessings to make Odisha proud, to make our dream come true and join us in our journey. Thank you so much. Vande Utkara Janani. Thank you.
Sure. Thank you so much, ma'am. I think that was very, very wholesome. I request all of you to please give her a huge round of applause, especially for this brilliant team from Megmento Pharmaceuticals as well, who have been so wonderful throughout. Thank you so much for your wonderful words and thank you for introducing your company so well. And with this, ladies and gentlemen, we'd like to break for lunch. We shall be having all our live workshops right after this. I'd like to quickly remind all of you that certificate courses are on a special discount of 50% just for today. And Vita Glow is also available on 500 rupees off just today. So I request all of you to make sure that you also avail the discounts, which is only and only valid for today. Apart from that, I request all of you to please proceed for lunch. Please collect your lunch coupons from the registration counter in case you haven't yet. With that, I'd like to request all of you to kindly proceed and join us for lunch, and we shall meet here in 40 minutes from now for the post-lunch session. Thank you so much.